The assessment will then direct those who need testing to 811 for arranging a swab. Our knowledge of this virus and how it spreads continues to grow. One question that has been asked repeatedly is around the possibility of transmission from someone who is infected but feels well. This has been shown to happen most often in people who eventually get sick but may pass on infection to others in the day or two before their symptoms start. I have always said that asymptomatic transmission is possible, but that evidence from the tens of thousands of cases in China indicated that it was not a major driver of spread. What seems to be emerging from more recent data is that outside of China, this asymptomatic spread appears to be happening more often than we had thought. Our Canadian Special Advisory Committee has been looking closely at the evidence around this, and yesterday we determined that we need to expand our approach to take this emerging evidence into account in our measures. One of the major implications for this is the use of face masks by those who are feeling well. We discussed this on Friday after the CDC in the United States enhanced their recommendations, and I have been getting a lot of questions around the effectiveness of face masks for the general public. What we know is that people who are sick spread illness. We also know that even with more asymptomatic transmission happening than we previously thought, all of the recommendations we have made about keeping 2 meters distant from others, having close contacts of cases, or returning travelers stay home for 2 weeks from their last exposure, those recommendations are more important than ever. In addition to, not in place of, following all of that advice, there may be added benefit for those who are well and in places where they cannot keep 2 meters distant from others to wear a face covering. Wearing a non-medical mask, such as a homemade cloth mask, has not been proven to protect the person who is wearing it. However, it may be helpful in protecting others around you. This is because face coverings are another way to cover your mouth and nose to prevent respiratory droplets from contaminating other people or surfaces. Additionally, wearing a mask may stop you from touching your nose or mouth. If you choose to wear a non-medical mask or face covering, it should be well fitted and not gape at the sides. You should also be aware that masks can become contaminated on the outside. Avoid moving or adjusting the mask. After wearing the mask, assume that it has been contaminated and take the proper precautions. Critically, if you wear a mask, you must wash your hands before putting it on, as well as before and after taking it off. Cloth masks should be worn only a short time, as there is some evidence that they can trap virus particles after they become damp, which may put the wearer at greater risk of being infected. For those choosing to wear non-medical masks, it may be prudent to carry a bag with several clean masks in it, as well as a plastic bag that can be used to safely store used masks until they can be washed at home. It is critical that used masks be carefully handled to avoid spreading infection to others. The most important steps you can take to prevent the spread of infection remain the same. Consistent adherence to good hygiene, such as proper hand washing, following all public health orders, staying home whenever possible, particularly if you are feeling ill, and practicing physical distancing when you need to go out are the best ways to keep yourself and those around you healthy. These practices will become even more critical in the following weeks. As we see people travel